I love you, Heartworm.
Welcome back to another episode of AutisHim, Black Fathers and Autism. We are back once again. I got my brothers, co-hosts next to me, Nick, Lonnie, Trav. We got a very special episode for you guys. So I met this brother at a workshop, a parent training, if you say, for the colors of autism. He was speaking about trauma-informed care behavior analysis. And I was just impressed with his wealth of knowledge of everything that he spoke about surrounding trauma and just caring for our children, especially our children of color. And man, when I tell you I left this workshop with just so much knowledge and understanding of things I've never thought about before, it was amazing. He's here with us today. Give it up, everybody, for Derrick Roberts. Give it up for him, guys. Derrick Roberts. So Derrick, I know you're a BCBA man, and like I was telling everybody, I've seen your presentation with the colors of autism. Tell us a little bit about yourself, how you got started in your journey, and where you currently are now.
Absolutely. First, thank you, Tyrone, and thank you, AutisHim, for having me today. I am originally from Jacksonville, Florida. That's where I went to high school, moved to South Carolina for college. I attended the University of South Carolina. I majored in experimental psychology and biology as a double major in undergrad. Went from there and got my master's degree in special education with the emphasis on applied behavior analysis. I did some work in an outpatient setting, providing feedback to parents and families when they received autism diagnosis, helping them understand what that actually means and the impact of the diagnosis, not only in the school place, but in the home, workplace, and wherever else they may be, in the environment. From there, let's see, when outpatient was in, I went to do some clinic work. So I worked along some RBTs, did some supervising. I supervised quite a number of staff with different presentations of autism. And now I'm currently back in school for my doctorate in clinical psychology, actually focusing on emotional regulation in Black and brown boys. So somehow we're going to make all these worlds merge together.
So in your journey, everything you just mentioned, I want to follow up with, because when I heard you speak, you were, really emphasizing trauma and how that, not just affect, people on the spectrum, but like all of us have some type of trauma in our lives, and we don't realize how that trauma shapes us into the adults that we are. Could you speak a little bit more about that, like, trauma-based behavior analysis and like what that means, and, just kind of go into that a little bit?
Yeah. So I guess the first thing that we can possibly talk about is the definition of trauma, right? Trauma is something that everybody experiences. And before we even get into a definition of it, it's important to know that two people can have the same exact experience, but walk away with two very different types of impacts from that experience. So trauma is a response to any deeply distressing or disturbing event that takes place. It's overwhelming. It impacts an individual's ability to cope. It causes feelings of helplessness, diminish their sense of self. It impacts their full range of emotions and experiences. So every part of the human body is impacted by trauma, right? It's not uncommon for people who have trauma to re-experience symptoms or re-experience traumatic events when they're not even encountering the stimuli that caused the initial trauma to take place, right? So everybody has trauma. We have big T's and little T's, right? Big T's are going to be those really, really big traumatic events that would, beyond any shadow of a doubt, Lonnie can look, Travis can look, Nick can say that's trauma, right? And then we have little t's, right? And we may say, okay, I can see how that is traumatic for you. However, I don't, that's not a big T, but what we want to be careful to do is never minimize someone else's experience of what is a big T or a little T. But those natural disasters, terrible car accidents that ends in some type of fatality, those are all big T's, right? So trauma impacts everybody. And an example of that is like George Floyd, right? Vicarious trauma. I wasn't there, but as a Black man, I saw it happen. I experienced it. I felt it. Now, when I see a police car and those blue and red lights going off, my heart rate might increase, right? I might grab that steering wheel a little bit tighter. Okay. That's vicarious trauma. I didn't experience it, but I'm still impacted by it.
So I have a quick question, and it's a very basic question. Some of our viewers are really new into the autism space. Like, we have people who are just, maybe getting diagnosed, or children getting diagnosed. Can you give the barbershop talk basic definition that everybody can understand regarding autism and what it means to that person and then the family around?
Yeah. All right. That's a big question because it can look so different, right? So with autism, what we're going to be looking at is really, it depends. So you take your DSM-5, that's a diagnostic statistic manual, right? That's where we diagnose people with bipolar disorder, mood disorders, depressive disorders. That's going to be our book, our manual, and our guide for all the characteristics that we would diagnose somebody with a diagnosis with. So with autism, we used to have things like savantism, Asperger's syndrome. And now what they've done is they removed all those terms from the DSM, and we solely rely on the term of autism spectrum disorder, right? And the emphasis is going to be on that word spectrum, right? Because that spectrum can range from level 1 support to level 3 support, right? We used to also refer to this as high functioning and low functioning, right? We've also gotten rid of those terms. So when we talk about autism spectrum disorder, we're going to talk about a neurological disorder. Some that even suspect has a genetic predisposition to it, right? And so people with autism oftentimes communicate, interact, and learn in ways that are different from other people. That's the most basic, simple definition that I can give it, right? Sometimes individuals with autism can be verbal and it can be nonverbal, right? They have expressive communication skills and receptive, and they may also have deficits in either or. Social skill development may look a little bit different, right? My 3-year-old may be completely potty trained, right, with autism spectrum disorder, and then I may have a 5-year-old who is not totally trained yet, right? And so that's why it's a spectrum. It's on a continuum. Most times it's diagnosed by the age of 3, right? Before the age of 3 in our white counterparts, right? But most of the time what we realize is that when kids are BIPOC, Black, brown individuals, diagnosed much later in life, 5 to 7 years old.
Well, definitely, I like the breakdown. You've been in this realm for quite a few years now, specifically for the African American community. From what you're seeing, do you feel that we are progressing as a community as far as understanding ASD, or do you feel that we still have some work to do?
I don't believe in either or, right? I believe it can be both and, right? I think that we are making progression, right? And we're moving towards something that's great, but I also feel like at the same time, we still have a lot of work to do, right? I remember being a BCBA in a clinic, right? I was in North Carolina at the time, and the majority of the clients that were there were all white, and I'm not upset at that, right? Because they need support and they need help too, right? And the clients that were white were preschool age, 2 years old, 3 years old. So we're working on skills like letter recognition, teaching them how to use receptive and expressive communication, toileting, eating programs, right? And I keep looking around like, okay, all the kids are white, and where we're at, this is it's a Black community. It's a very, very diverse place, right? And maybe we would get kids of color. They'd be like 5 or 6 years old, right? And at that point, they've already missed those pre-developmental stages that I'm already working with their white counterparts on. I would even see, in the school system, a lot of our Black and brown boys get diagnosed with oppositional defiant disorder, right? Pervasive developmental disorder, anything but autism, right? Because sometimes, what we learned from being culturally competent, right, is that across cultures, different diagnoses manifest themselves in different ways, and it looks a little bit different, right? We're going to slap on ADHD for a Black and brown boy because they don't understand the way that we as a people communicate. And so I think that we have a long way to go, but I do think we're moving in the right direction. And a part of that movement in that right direction is having more clinicians of color and having more spaces where people like us can come together and have these types of conversations.
So, Derrick, to that point, having more clinicians of color, just from my own experience, and I don't want to pretend like I know every clinician on planet Earth because I don't, but in my experience, I've seen maybe a handful of clinicians of color. I remember I went to a conference at Eastern Michigan University, and it was a behavioral conference. And so when I got into the room, there were people of color in there, but definitely the minority. Mostly everyone in the room was white. And again, there's nothing wrong with that because we all need, the information, the care. So I totally understand that. The question I want to ask is, how do we push people of color to even want to pursue being in this field? Like, how does that become, a more topic of discussion? Because the ones I've talked to, and I've heard Nick say this, when you find you a good BCBA that's of color, it's like a unicorn. It's like, man, I didn't find my treasure, because it ain't a lot of y'all out there. How do we make that more of a topic of discussion from the K through 12 through the higher education ranks to push people more into this field?
Yeah, I think that's a big question, right? But it starts with conversations like this, right? In Black and brown communities, at least from where I grew up, we always had this whole idea or this framework of what happens in this house stays in this house, right? Yeah. We don't talk about it, right? We don't talk about mental health enough. All right. And there's also not any equity between mental health and medical health, right? It's all medical, right? Because it's a part of my human part. I think we need to have more conversations, more exposure. And a lot of people don't even know what a BCBA is, right? And when they do find a BCBA, they think that our work is also limited to autism, when the reality is that it's not. All right. And so when you think about the field of psychology, applied behavior analysis in the general realm of psychology is one of the newer disciplines. The certification hasn't been around as long as some other certifications. But I'll just be really frank with you that the journey to becoming a BCBA is arduous. It's very, very challenging, right? And so it takes a very dedicated person, somebody who really has a passion for the field, to be able to go through it and to do it. And people get that passion from people like us sharing our stories, right? I don't think if I had ever met an individual in undergrad who had a learning disability, I don't know if this would be the path that I would be on, So it comes from that personal experience, that personal connectivity to other people, to let them know that there are opportunities out there for people of color to become BCBAs. And it's a good field to be in, right? And you're right, we are unicorns. I think the last time I checked, 3% of BCBAs are Black. 3%, right? This was in 2019, I think. Last time I looked, 3% of all BCBAs are Black. And then if you look by sex or gender, 1% were male. That means 1 out of every 100 BCBAs is a man, a color.
You talked about, we asked about progress and how we're doing. And I think it's interesting that we know that there's still a 3-year delay with diagnosis between our counterparts, but they're seeing higher rates of prevalence. So we're actually starting to be diagnosed at higher rates than whites and some of the latest numbers. And so I think about that and the fact that there's also a lot of intellectual disability being diagnosed too at the same time. But I want to point out what you said earlier. I think a lot of that goes back to the fact that they haven't been taught or had opportunities to get those very early developmental skills and, pre-K and younger. And we're seeing these crazy rates of school suspensions and preschool, kindergarten. I didn't believe that data when I first saw it about suspensions and suspension with autistic kids, but you're missing not just the developmental stuff, the A, B's, and C's and stuff. You're missing social opportunities. So I don't think people understand how much a suspension or school removal can really affect Black and brown or any kids with autism, especially. So could you talk a little bit about that and the importance of that early intervention and sort of intervening and preventing that?
Yeah. So I'm gonna go back a little bit further than that, right? So just talking about Black and brown people as a whole, right? When it comes to mental health, we don't talk about it, right? Even as men, when it comes to our medical health, we don't take care of ourselves in the way that we should, right? And so what happens is there's this thing called intergenerational trauma, right? Intergenerational trauma. So it's basically what was passed down from my grandma, my great-grandma, and my grandpa, and my great-grandpa. That keeps passing down from generation to generation to generation, right? And so if we have this mentality that, we're not taking care of ourselves, that's only going to bleed down to further and further generations. Now, I will be the first one to say that the systems capitalism that we work in, there's systemic issues in our system that keep us from going to trust these systems, right? They mistreat Black and brown people. There are barriers in place that keep us from going in to get that checkup, that keeps us from going in to get that evaluation. There are barriers there, and I understand and I get it. However, either we're going to look at our children as parents and say, and it's hard, and I know I don't have any kids, and it's hard, right? But if my child is not meeting these developmental milestones, I have to make a choice. Am I going to take my 6-month-old, my 1-year-old to a pediatrician or to a psychologist or somebody who can give me some answers as to why these developmental milestones aren't being reached, right? And so if a parent does happen to be listening right now, there is something called neuroplasticity, right? So between the ages of 0 and 5, kids can reach major milestones, make a lot of regression, reach a lot, make regression. It happens, right? But there are fundamental milestones that children should reach. And if they don't reach those milestones, your gut tells you. But I know fear also lives in our gut and keeps us from going forward and making those appointments, right? But I really want to drive it home. If you notice that your son or daughter are not making those fundamental milestones developmentally, get them in treatment as soon as possible. And at the same time, I'm talking out two sides of my mouth. I know it's difficult to get the diagnosis, right? I know we are often mislabeled, right? They want to give us everything else except for ASD, right? I know it's challenging, but I when I speak to, typically when I'm in these spaces is with women that are moms, and so I call them warrior moms, right? When they see you coming, they should know what it's about, right? They get tired of you coming. I don't care. I'm here on behalf to advocate for my child. I'm here to advocate on behalf. If you got to get the Department of Disabilities and Special Needs involved, whatever you have to do, I admonish you to do it. But yeah, early intervention is very, very important. Between ages of 0 and 3 years old, there are so many skills that children learn and gain, right? And one of the biggest things that you mentioned, Lonnie, is socialization, right? I have nieces and nephews and godkids, right? Who are at home with their mom and dad, and they're fortunate that they don't both have to work. So the kids don't have to go to daycare, right? And so parents would be like, oh, they're fine, they're good. And the reality is they are fine, they are good, right? But then the moment they get into preschool and they're around other children, they're saying all these words. There's all this language. There's all these skills popping out, right? And that literally speaks to what Lonnie's talking about, right? Kids being around other kids, being challenged, they learn and they soak up everything like sponges, right? And so it is important that kids are around other kids. Furthermore, if kids are in school, right, and our kids are getting suspended, put out of the classroom, sent to ISS, or whatever it is, our kids are missing out on vital learning opportunities that impact their long term. ability to accomplish, right? And I can't speak to it enough. So that's going from teachers in the classroom, like pay attention, sit with it and think about it. Don't slap a consequence on what type of restorative practices can we put in place in schools to keep our kids in there. Yeah.
So I have another question centered around the BCBA profession. There are people like myself who've had great opportunities with BCBAs. Like I said, my son has a BCBA and we love him. Unicorn, African American system. But there are also people who have the opposite, experience with a BCBA. And I've heard the naysayers. I've heard a lot of the negativity towards the BCBA field based off of people's personal experience. Could you speak to that thought process of, people stating negative experiences as gospel when it comes to the BCBA field, their tract, et cetera, et cetera?
I think one experience doesn't define all experiences, right? The way that I think about therapists in general is that therapists are like shoes, right? You try it on, if it doesn't fit, take it off. You try a new one, right? I also have this saying that, in theory that sounds great, but in practice that's kind of difficult, right? As it is, there are a limited number of BCBAs in general, right? And so you don't have the ability to keep just switching providers. It's hard enough to find a provider as it is, right? But what I think you're saying, Nick, is if a parent is having a poor experience with the BCBA, what do they do? Is that your question?
Or what would you like? How would you speak to the negative talk that is surrounding the BCBA profession or the ABA therapy profession?
Okay. Yeah. I think that's hard, but what I am going to start with is to each his own first, right? I've been in the field of applied behavior analysis for almost 10 years, right? And it is some of the most empirically evidence-based practice that there are out there, right? I've seen it work. And I know it works. I genuinely care about people. And if I didn't think this was a good field, I wouldn't be in it at all, right? But I do realize that ABA can have a bad rep, right? Even some people with autism speak negatively about their own experiences in ABA therapy, right? I totally get it, right? I think every discipline within the field of psychology, nothing is cookie cutter, right? And so I go into this ABA program and I try to enforce this ABA on someone my way. There's actually an ABA program called My Way, right? And I don't ever consider the human or the person that I'm working with, right? And that's going to go back to what we talked about earlier, right? Trauma-informed ABA, okay? My first goal is to do no harm. And there have been times where as clinicians, we have caused harm to people. We have to first own that, right? But we have to be trauma informed and care about the person. The thing about ABA that I struggle with, and also why I went back to school, it's a big phrase called mentalism, right? And mentalism means that we don't really engage with the person's feelings, the things that we can't see, the internal working model, right? But what I'm learning now as a psychologist in training is that I cannot look past a person's feelings and their experience, right? And try to just put this behavioral practice in place, right? If I don't know their history, their trauma history, what's happened, I'm going to end up causing harm in some kind of way to this person, right? So for those who do speak negatively about ABA, I'd love to hear them out. And I would love to hear your experience. But I want to emphasize that one experience with ABA does not define or make the entire field. Because ABA works. I've seen it work time and time again. across cultures, across disciplines. I've seen it work with people who are not on the spectrum. They just call it organizational psychology, but it is ABA in a workplace.
Yeah, I totally agree. I was a bit nervous to put my son in ABA about 2 years ago, but it's what needed to be done, and it was a decision I was able to make with my wife, and it helped him progress great. My son had a severe echolalia, definitely had a hard time holding conversation, so he was definitely able to, be able to expand his vocabulary as well as learn to play with others in that environment. And I'll even kind of relate myself to it. I think my biggest thing was I was stubborn. It took me a while to accept it. When you have a son, and I'm sure everybody can relate, you're like, hey, I want my kid to be perfect. I want them to know that they could do whatever they can, but with them being a bit limited, it was a tough pill to swallow. But I say definitely BCBAs do a great job. So, I mean, right now, if you could speak to our viewers and our parents who are having that hard time, what would be the first thing you would say to them to kind of let them know, like, hey, you have to take that first step?
Yeah. So, yeah. I'll first start off by saying that I don't have kids, right? I don't have children, right? And so there is no way that I could ever understand the gravity or the weight of what parents carry, right? I could never understand the weight that a mother carries or a father would carry, right? Just having a child, period, right? The stress of it all, right? In not even the stress, but the amount of love that you have for your own child, right? That's something that I can't understand, right? But I can see the pain, right? And I can sit with you in it and carry that with you. But for a parent or guardian who may be listening, who does have a kid, and you may be noticing that something just isn't right, or you may have just gotten a diagnosis from a psychologist or from a medical doctor. It hurts, right? It really hurts. And let me put it this way: it may hurt because it may not hurt for everyone, right? But for the parent that is hurting and is devastated and crushed by this news, right? I think your feelings are fair. I think they're valid, right? I believe for some people, receiving a diagnosis of autism is a traumatic experience, right? You've dreamed all your life of what your family's going to look like. You've dreamed of having these kids, of what you're, and in one moment, in an instant, the doctor gives you this diagnosis, right? Your world in some ways can be shattered. What I also want you to know is that your kid is the one who carries the title of the diagnosis, but that diagnosis impacts your entire family unit, right? And likely will impact your family unit for days and weeks to come. So I sit with you in that. I don't get it because I haven't walked in your shoes and haven't walked your walk. But I only encourage you to sit with that feeling, lean into it, cry if you gotta cry, have your moment when you gotta have it. And when it's game time, I need us to stand up, right? And be the adult that our children need. And that's easy for me to say because I don't have to do it. But I am asking you to do it and seek out that help, right? There are people out there who are genuine, who want our kids to be successful, as much as you do. So if you're listening and it's hard, I get it. Even sometimes you have a kid, they've been on the spectrum for a couple of years and they're doing well, and then all of a sudden there's this big regression. It's a constant roller coaster. And I've seen a lot of it. So I know the weight that you carry is heavy. But all I can do is help you hold your arms up as best I can. Yeah.
I got a sort of a different question, changing topics a tiny bit. A lot of folks in our group have had conflict with schools in some capacity. The amount of time and energy we spend getting our children the best support that they can and what they need it's a continual challenge and battle of just pushing. But something I've been thinking about a lot, and I go back and forth on, is the idea of location, least restrictive environment or not. Should my kid be in the general education classroom, isolated classroom? And I and I see different things in literature, but where I fall more lately is just historically, Black and brown kids have been put in segregated classrooms, especially with autism, and then not given a support that they need. They don't have to practice, socializing, et cetera, et cetera. But I was pushed initially to put my kid in a segregated environment. My response was no, because I know this is a dungeon, right? But I also recognize a general education classroom can be a battlefield. You can have significant bullying. You can have a lot of bad things happen in that space too. So if I was a parent with my child, new diagnosis, given a pros, I know it's child specific, but can you talk a little bit about your thoughts on the learning environment for kids with autism?
Yeah. I think across the board, regardless of whether they need level 1 support or level 3 support, right? We always should push for inclusion. I don't care how significant the diagnosis, how significant the delay, we always push for inclusion, and we always push for the least restrictive environment. Always. Right? And that doesn't just mean they get to go to PE. Right? Always least restrictive environment. Now, if it comes to the point where a student is a harm or danger to themselves, to other people, of course, you make exceptions for that, right? And if their behavior is impeding the progress of their own learning or somebody else's learning, right? That's the legal term. That's an IEP. So we have to stick by that. Other than that, always least restrictive, always fighting for inclusion. And that looks differently, right? In individual education plans, they have service hour requirements, right? And so that tells you how much time does student spend in general education math, general education English, or whatever topic it is, right? If that IEP says they get 10 minutes in math every day, that's service hours, right? Your IEP is a legally binding document, right? And if the school is not providing that support or not pushing into that general education classroom, you have a legal matter in your hands that you take to the school district, right? And you fight it tooth and nail. It is exasperating to be a parent in general. It's twice as exasperating to be a parent of a child with autism, right? You're constantly fighting, and it's going to be endless, until they see Lonnie coming and say, "Oh, it's Lonnie, just whatever he won't give, let it go." But yeah, I say always push for inclusion, always push for least restrictive environment.
Derrick, I wanted to kind of go back to piggyback on what Travis was saying, because of course we're trying to push the conversation for all families of color, but specifically for men of color. I've seen it. The fellas on this call have seen it. I'm sure you've seen it. When you go to trainings, when you go to workshops, it's majority mothers, majority women.
Yeah.
In your opinion, what needs to transpire or needs to happen in order to get more men of color involved in being involved not only in the child's life, but just being a part of the conversation? Like, how do we kind of get to that place where we're seeing more dads at, conferences and workshops and things of that nature?
Yeah. I think exposure first, right? Knowing that there are conferences out there that parents in general can attend. That's a start. What I've seen in the last couple of years, which I'm so happy about, is there have been more organizations specifically for people of color, like Black Men in ABA, Black Applied Behavior Analysis, right? These are groups that are being cultivated and created worldwide, that are spaces just for people of color, right? I think the more notoriety that these groups get, the more we will see people of color entering into the field first, and creating more spaces for parents, right? Something that I will always dream of doing whenever I graduate from school is having my own clinic that's a wraparound clinic. But anytime a child's in treatment, I think the parent has to be in treatment, right? Because what's happening in the child's life is impacting the parent's life just as much, right? And if I'm not helping the caregiver, then I'm doing a disservice to the child, right? And so I think a big part of that is also behavior analysts, those of us who are in the field, really engaging our parents, right? And when mom shows up, hey, can we get dad on at least virtually? I know he's maybe at work. Maybe he can join us for maybe 30 minutes, or we can schedule this call during his lunch break. It's important to me that both parents are involved and that they are present, right? That's what I think we can do as behavior analysts. But I think the field needs more lights shined on it, and I think that is happening. I also think that in the next couple of years, we will continue to see more dads actively playing a role in their kids' healthcare. There's a lot of research and studies going on now that support that millennial fathers are twice as involved or twice as active as previous generations of fathers have been. And so I'm excited to be a millennial and also looking forward to seeing how this kind of continues to unfold. But research says that we're holding it down. So I'm gonna cross my fingers and hope that we keep it up.
So I know that I said that this is going to be like a barbershop conversation. It's actually turned into, digging deeper and digging deeper and digging deeper. I want to hopefully try to lighten it, but still give it some depth as well. With your experience inside of the school system, as a clinician, in your education experience, could you give a fairy tale dreamland school type of creation for children, specifically of color, specifically African American type of environment that you would love to see occur to be able to help guide these children through the educational process and through the life process, and still be culturally relevant inside of the space as well. So we're going into the dreamscape, so to speak. But I would really like to know what that would look like from your position with your background in education.
Yeah. So what I'm gonna do to answer your question is I'm gonna throw all of my educational training to the side right now, right? And what I'm gonna talk about is love, right? I think love is the answer to that question, right? Genuine love and care for other people, right? Social justice, equality, all those that is what Dr. King's preached about. That's it. Love, right? If a school can have love, that's it. Love, grace, compassion, right? Those are the things that are, in my opinion, missing from schools, missing from teachers, missing from administrators. So if I could create an environment or a school for individuals on a spectrum to learn to matriculate through life, a school that's filled with love, compassion, and understanding. And if a parent doesn't feel that when they go into school now, I say turn around and get your kids out of there. Because that's it. That's it. Because there's nothing that love won't do, right? There's nothing that compassion won't. And with understanding, like with those three things, that's a fairy tale school for me. That's it. Because above all, I want my kids to be in a safe space. And I think you gotta have love, man. You gotta have it.
You remind me of the importance of just your kid knows when someone mess with them. I almost said the other word. They know when somebody care about them, look out for them, right?
Mm-hmm.
But the thing I would add though too, just the importance of and I struggle with this myself, the importance of expectation, but then also getting out of my kid's way. Sometimes my protection can become prohibitive. So I gotta back up and so make sure that I let my kid fall and scrape his knee on occasion, right?
Yeah.
Like me, I'm having a hard time teaching my son to ride a bike because I don't want him to fall, right? My other two kids, good, they can ride a bike. You can go ahead, fall, bust your head. But my baby, I'm overprotecting him. So I'm gonna have to get the neighborhood kids to teach him because I don't have that muscle because he has autism and I'm overbearing with it, right? But I think that too, just having that in there, I'm finding that with not just educators but parents too, And sometimes our expectations are what can limit our kid more so than you said it earlier. Your kid has that diagnosis, you don't, but it can affect the whole family. But sometimes the biggest limiter in families is how parents feel about the autism, because we get in the way.
Yeah. Yeah. And I've been in different spaces and we all talk about it and we think about it differently, right? It's not a disability, it's a ability, right? And we say it's not a limitation, it's just something that's diverse or that's different, right? And yeah, I get it. So it's hard for parents to get out of the way, right? That's my baby. Oh, wait, what if? Like, that's how little anxious thoughts and our anxiety like peaking up, right? Everybody has anxiety. This is normal, right? Anxiety is a good thing, right? Anxiety teaches us when we need to run and when we need to fight, right? But if you got too much anxiety, it can be kind of detrimental. So, dads, if you're out there, moms, if you're out there, you got to turn your back, take a breath, tell your spouse or your partner or your older someone to keep your eyes on them. I can't, like you said, Lonnie, I can't do this, right? It's too much for me, right? I got to do this in doses. We can't practice riding the bike for 20 minutes. I got a good 5, but you can't allow your anxiety and your stress to limit your kids' growth, because kids are way more resilient than we give them credit for. Yeah.
Derrick, I want to ask this question, and it's a question, but I also want you to like comment too on this, because I don't know for a fact, but this is just things I've heard, because my son, former BCBA, he no longer works with her, but this was something we used to talk about with her, my family and I. We would talk about just burnout, right? The field being burnout and having high turnover because of that. I wanted to just ask you, what are some ways, because I don't know what the burnout consists of. I don't know like the ins and outs. What is some ways, first, I guess, talk about the burnout if it's a thing. And then secondly, if it is a burnout, what are ways you think that the industry can change in order to prevent turnover and burnout?
Yeah, I can speak to that. Definitely speak to it, right? Burnout is real, right? And when I was in North Carolina, I worked for a company, right? ABA is a very lucrative field, right? Especially for those who own their own businesses and they have like multiple locations across states, right? It's very, very lucrative and they can serve a high number of clients. What they do is there's something called a medical necessity, right? And they say, oh, this kid needs 40 hours a week. This one needs 38 hours a week. This one needs 40 hours a week. So for every kid that I have on my caseload that has 40 hours a week, per the board, I have to provide a certain percentage of supervision for that kid. So if they're getting 40 hours a week, I should be supervising them a minimum of 4 hours a week, right? Most people work 40 hours in a week. But if I have 15 to 20 patients or more than that, right? Those hours are getting longer and longer and longer. And so that's one thing that leads to burnout. The other thing that leads to burnout is, it's not an easy job, right? I've worked with 17-year-olds who can tear up a house. I mean, tear it up, tear it apart. Okay. Some really aggressive and maladaptive behaviors, right? Sometimes it can get intense, right? I'm talking about, 17-year-old taking feces and throwing it, right? Gotta be quick, gotta dodge it, right? But it happens. It happens, right? And so it's not an easy job, and burnout is real. However, the flip side to that is like when you love what you do and you see them reach those milestones and they're making progress towards those goals, those moments, I promise you, outweigh all the burnout, and it refuels that flame and keeps you going. But I'm not gonna lie and say sometimes it's just like, whew, I need a break. I need to breathe. But BCBA's got to take care of ourselves. I like to go to the gym. That's what works for me.
It kind of reminds me of special education teachers and how we're seeing it's been that way for a minute. So many leaving the field. The people who get more training than most to deal with kids with different behavior and developmental needs are leaving at higher rates. I think that's, very akin to what we're seeing with the BCBAs too.
Yeah.
Derrick, I know you got to go. I got one last question to what you just said. If someone is having concerns or issues with the facility they're working with their BCBA, let's say they have an issue with the facility, who do they report that to? Like you mentioned a board. Is there a board? Is there like governmental things? Like who do they report to?
Yeah. So first, I would always tell any parent or anyone who is having an issue at their location, start there first, right? Ask for the clinical director. If you're going to get it from the clinical director, ask who their manager is, When you've exhausted all of that, there is a board, right? There's the board, BACB.org, right? It's the Board of Applied Behavior Analysis. It's our governing body, right? You can file reports anonymously on RBTs, BCABAs, and BCBAs. Something unethical is happening, right? If something unethical has happened, immediately report it to the board, right? You can copy y'all and just let them know, hey, right? We have this thing called due process, and so they'll investigate and figure out either way. That's for our national board, right? Within states, there's here in Connecticut is called DDSN, the Department for Disabilities and Special Needs. Some places just have the Department of Public Health, Department of Mental Health, DHMS, depends on where you're at. But yeah, I would utilize all those resources. But I will always start with the company first. If you're not getting answers, give them a week, 2 weeks, and escalate it. Keep going up. And if you don't know exactly what to do, find another BCBA, right? Who you can just talk to and consult with. A lot of places also have educational lawyers, educational attorneys, right? Go to your pediatrician's office, tell them I'm having this issue and I need support with this. Who can you point me into the direction of? If you got to reach out to Autism Speaks or different organizations, be relentless in your efforts to protect your child. Because likely that something happened to your kid is not the only one, right?
Right.
Okay, I do have one more question to lighten it before we leave. It should be really, really quick. Before you go, try to always leave off with this question. Can you give some tips and tricks to parents who could be struggling with this whole thing? You may have mentioned some things before, but just to kind of round this out in a nice, clean fashion, what kind of guidance would you give to the general parent, has a child on the spectrum? What tips and tricks would you give them based off of your experience?
Yeah. Take care of yourself. And that looks different for everybody, right? Take care of yourself. And again, it's really easy in practice, hard in theory, right? If that means at night, once you put the kids to bed, you take 10 minutes for yourself and do nothing and sit down before you do the dishes, before you clean up the mess that they left in the living room, before you clean the table, take 10 minutes for yourself, please, right? I had this thing, when you're feeling overwhelmed, the answer to being overwhelmed is doing nothing, right? And so, I promise you, it seems like nothing, but if you take a timer and you set the timer for 5 minutes, clear your head and do nothing for 5 minutes, right? And then take another 5 minutes, scroll on Instagram, do something that you enjoy for those 10 minutes. Just if you can get 10 minutes for yourself every day, or at least 3 times a week, try it. Work out, go to the gym, take care of your body, listen to your body. When you need a break, find ways to get a break. Take care of yourselves. Yeah, that's a hard question, Doc, but I mean, you got to do it.
All right. Well, it's a wrap for our show. We want to thank our guest, Mr. Derrick Roberts, for dropping by and giving us all the knowledge and all the information. We really appreciate you, Derrick, stopping by. This is, again, AutisHim, Black Fathers and Autism, and we out.